And so tell us about expressive arts. Like how does that work in a therapeutic process?
So expressive arts is using the process of art making as part of therapy.
Mm-hmm.
And so it's really about how your brain is functioning at the time that you're creating.
Mm-hmm.
And it, in my opinion, is a great way to experience therapeutic change without just talking in circles. And it engages different parts of the brain. And particularly for things, my favorite places to use expressive arts are when there's something that is a little bit too big or too scary, when there's something that's repetitive, when there's something we've already talked to death, but there needs a little bit more expansion on. And I think if therapy were structured different, it would be ideal. Because I think if I had everything at my disposal, I would spend an hour and a half with each client, right? And we would sit down and just make art together while talking.
Mm-hmm.
But the way that I do it is more like a homework assignment. And so I'll take something that somebody's working on and then say, what if you did some creating around this? I might suggest a media, but then say, please take this where it feels like it's right to take it. And then when they complete that, or the next time we meet, whichever comes later, then we kind of process through what the experience was like. And so it's a little bit of an amalgam of making telehealth work and making, the traditional hour-long therapy session work, and then letting people kind of go their direction. And sometimes it comes up like we do back-to-back experientials, and other times it's something that, is not feasible to do all the time because people are busy.
Mm-hmm.
So it just kind of as it's appropriate, as people are willing or interested,
Mm-hmm.
is something that gets used as part of therapy.
You have the knowledge of expressive arts and you like to bring it, but it's not necessarily like you only do expressive arts in therapy, right?
Absolutely correct. Some people it's not something that they want to do, and that's okay.
Mm-hmm.
And other people, if they're naturally creative, they like doing something they want to do, or for people who feel like, one of the reasons I was interested is that my own experience with therapy had been a little bit stagnant, and that talking and talking and talking, I could explain over and over why, but I couldn't necessarily embody the changes. And so for me, making art was a way to kind of close that gap.
Mm-hmm.
So I think particularly when there are people that really want to do something different,
Mm-hmm.
then it's effective. And for other people, that's just not necessary, or not, they're, where they are. So